Thank you for being here today for our latest Med Talk. I'm here with Jen Vanderwater. Jen, how are you doing today?
I'm good, Chris. How are you?
Good. A little worried now about my oral health after what I've been learning and what we're here to discuss today. People don't realize that oral health affects more than just your mouth. Dr. Vanderwater, there are a host of different issues that can be affected by your oral health, endocarditis, cardiovascular disease, there could be pregnancy complications, even pneumonia. How is that possible? What causes this?
Yeah, well, what actually causes this is increased risk of bacteria in your mouth can get into your bloodstream. That's the first thing. Secondly, is increased inflammation. So when you have bad oral health, your body, it's another area that's increased inflammatory factors, and prolonged inflammation leads to other events like cardiovascular health, and anything you can imagine, with it, even neuro damage. There are things that are happening in the body that are all connected to oral health. Your teeth are actually connected to points in your body. Each tooth, if you actually look up a diagram of the mouth, it's very, very interesting. Each tooth is correlated to an area of the body. And when we're not taking care of our teeth and we end up having going to the dentist and having one removed, you're actually causing damage to an area of your body. So that is one of the things in researching and looking into good oral health. It's actually affecting the whole body.
Interesting. And how's that possible? I mean, what exactly causes it? Is it just the bacteria? Are there other factors? And it seems like conditions in the body can also affect your oral health going kind of the other direction. Osteoporosis, diabetes, even Alzheimer's. Can oral health be affected by so many of these different things the way you describe?
Yes, actually, and it's true too through diet. So when we choose to eat high sugar foods, a lot of carbohydrate diet, we are adding to our mouth a very high concentration of, that area where bacteria can grow. We're giving it a good place. And so that's what starts the process, increase in the bacterial growth. And then once it's in your bloodstream, that's how it gets there. Secondly, with high sugar, soft drinks, high acidic foods, a lot of carbohydrate diets, what that ends up causing is a very acidic environment too in your mouth. And we know high acidity equals high inflammation. And after time, it doesn't stay concentrated just to your mouth, especially if you do not, brush routinely, or even use probiotics. That's another really key factor in having the beneficial bacteria in your mouth to help combat the bad bacteria that can cause these problems in the long run.
So it's really all about bacteria. This bad bacteria has an opportunity when you don't have good oral health, and then that cascades these effects through other kind of systems in the body. Is that a good way to describe it?
That's a good way. And also the high acidity, increasing inflammation. And that spreads beyond just, oral, your oral area. It can go to your heart. It can go to your brain and increase, your osteoporosis. Everything all links together through your mouth. And so it's very interesting when you start to break it down. Another thing in researching, oral health that's really important is without good oral health, you're starting to have low quality of life, lack in self-confidence, and poor nutrition. So you're not getting into your body what your body needs. And if you have poor oral health, it's hard to eat foods that require a lot of chewing and breaking down your food. And the mouth is one of the first places where digestion actually begins as well. So if you're not able to chew your food, you're not digesting well, absorbing the nutrients. So that actually cascades into a whole nother issue, which can lead to other complications and other health conditions as well when you're not getting the nutrients your body actually needs.
So the wellness company and our partner One Dental offers a strong bone supplement for teeth and osteoporosis as well for many of our viewers, and offers an oral probiotic. Can you talk a little bit about each of those and how they work?
Sure. Yeah. Vitamin D with K is very important. Our bone product is actually great because it does help. It has added benefits to it with magnesium for absorption and bone strength. And the probiotic, like I mentioned, it's very, very important for oral health because just on a routine basis, even if you do have good oral health, you do want to have good bacteria there to give you the benefits and fight the bad bacteria to keep your body in balance. That's really what it comes down to.
Great. And of course, regular checkups and and seeing the dentist are a big part of it as well, right?
Correct. You want to make sure you get cleanings to get the plaque. You don't want plaque buildup. Plaque buildup will lead to gum disease. And then with gum disease, again, you're opening yourself up to a whole lot of inflammatory factors, the bacteria getting into the bloodstream, causing problems throughout your body, and you'll just be very unhealthy. A healthy mouth is essential for a healthy body.
Well, great. And of course, at the Wellness Company, along with One Dental, we have an amazing new solution. This is the One Dental Wellness Plan. It includes savings of 15 to 60% on all types of dental care, member discounts and free shipping on supplements like our probiotic and strong bone formula, as well as other oral care products like a teeth whitener and straightener, and 20% off all virtual services for other healthcare needs. So it's a great combination for this partnership. So Dr. Vanderwater, thanks for being here today and talking about oral health.
You're welcome.